Hello everyone, my name is Jiayu Zhao. Today I'm going to talk about the public health problem of hypertension. Hypertension or high blood pressure is a common chronic disease originating from genetic, environmental, and social factors. Genetic factors include multiple risk allele, gene interactions, and fetal programming. Environmental factors contain unhealthy diet, inadequate physical activity, and overweight. Social factors contain health education, health access, wealth and income, occupation, and so on. According to the American Health Association, hypertension happens when blood pressure is consistently higher than 130 over 80 millimeters of mercury. The World Health Organization also gives the similar explanation about how hypertension happens here. The WHO presents that around 1.13 billion people worldwide have hypertension, and 2/3 live in low and middle-income countries. A 2015 report demonstrated that 1 in 4 men and 1 in 5 women had hypertension, which indicates that men are more likely to have hypertension than women. In addition, worldwide, 7.6 million premature deaths were attributed to high blood pressure. The future of the community with hypertension still face high risk, including heart failure and heart attacks, kidney failure, stroke, amputation, hypertensive retinopathies in the eye, and other complications. The etiological factors for hypertension include unhealthy diet, physical inactivity, drinking and smoking, overweight, or obesity as modifiable risk factors, and non-modifiable risk factors such as genetic inheritance, aging, and coexisting disease like diabetes. The National High Blood Pressure Education Program have been used to increase the awareness of hypertension, especially population with a high prevalence of hypertension. The Centers for Medicare and Medical Service provides 50% for free for service payment by 2018 to alternative payments. After the implementation of Kaiser Permanente North California Hypertension Control intervention, the overall BP control rates at the initial point sites improved by 6%, jumping from 68% to 74% over a 2-year period. Besides, the Centers for Disease Control and Prevention has implemented the heart disease and the stroke prevention programs and a population-based approach to prevent the disease. As a result, to prevent the recurrence of hypertension, it's important to improve the levels of hypertension and the obesity-related knowledge to promote the scientific exercise and a healthy dietary pattern to develop a good lifestyle. Besides, the physical examination center should also be combined with the clinical practice to establish an improved medical protection system and follow-up system to strengthen the prevention and the treatment awareness for hypertension, and to conduct the publicity of health education for the hypertensive patients. What's more, a complete health fair about hypertensive populations should also be established to improve the understanding of hypertension, to control the relevant risk factors. Personally, hypertensive individuals should form healthy living habits. Secondly, community and society could establish organizations to increase the public awareness of hypertension. hypertension. Thirdly, governments need to complete their health care system and try to use technology to develop reliable and effective methods for prevention and treatment of the disease. Thanks for your attention.